This is Hannah from Lyme Advise, and today I have the pleasure of speaking with Dr. Joseph Trunzo, the author of Living Beyond Lyme. How are you today?
I'm great, Hannah. Thank you. I appreciate the opportunity to talk with you today.
Your book, Living Beyond Lyme, focuses on living a meaningful life and using mindfulness and acceptance and commitment therapy approach. What was your motivation or inspiration in writing this book?
It was really a confluence of circumstances. I think, like most people who are doing any significant or serious work in Lyme disease, um, I've had personal experience with Lyme disease. My wife was very, very sick for quite a while. She's much better now, thankfully. But having had that experience with her, coupled with my professional background being a clinical psychologist, having a history of working with people who have various chronic illnesses, just kind of inspired me to I felt like I had something to offer. So, and in learning more about the acceptance and commitment therapy approach, I really feel is a very good model for people to work with who have Lyme and chronic illness. So it kind of just all came together and led to the book.
You began your career in research with cancer survivors, but have transitioned and focused your efforts on Lyme disease and other chronic illnesses. I think you touched on this in the previous question, but what caused or motivated this transition?
So some of my personal experience, of course, but to be honest, I had a wonderful career doing cancer research. I focused on that all through graduate school. It was exclusively what I did in my postdoctoral fellowship, and I was really happy and thankful to be involved in that work. The shift came really when I realized that there are untold dollars dedicated towards cancer research, and rightfully so. And there are hundreds and hundreds and hundreds, if not thousands, of researchers and clinicians working on cancer issues, even just specifically the mental health aspects of cancer, so it's really hard to feel like you're making a difference when the pool you're swimming in is that large. But when I learned more about Lyme, I realized there really aren't a lot of people doing this kind of work, and I felt like it was something that I could be more impactful for, and the work could actually reach people who are very, very hungry for this kind of material, because there just aren't as many people researching this stuff as there are people who are researching cancer. So it felt really, really meaningful to me in that way.
Can you please explain what the acceptance and commitment therapy approach is?
Sure. So I'll do the best I can to give you a little synopsis. So acceptance and commitment therapy, or as we refer to it, we call it ACT. It's basically a psychotherapy approach that focuses on 6 core processes. We call those processes diffusion, acceptance, contact with the present moment, self as context, values, and committed action. And we work on those 6 processes, all with the goal of helping someone to become what we call more psychologically flexible. That sounds like a fancy term. But all psychological flexibility is putting yourself in a space where you have an acute awareness of your own sensory, cognitive, or thoughts and emotional experience of the present moment, right here, right now, doing so without judgment. And then that ideally allows you to make decisions about what you do in terms of your behavior that are based on things that really matter to you, as opposed to engaging in efforts to try to escape, extinguish, control, avoid, or chase particular emotions or feelings. So that's a mouthful, but it's kind of the best I can do to sum it all up in a couple of sentences.
You've given a TED Talk regarding your book and the ACT approach. How was that experience? And in short, what did you discuss?
So that was one of the most terrifying and exhilarating experiences of my entire life. So the TEDx talk, the university that I work at, Bryant University here in Rhode Island, offered a TEDx event, and I applied to become a speaker, and they were kind enough to grant me the opportunity to do that. I'm a college professor. I do a lot of public speaking, but I'm not typically taped and put on YouTube for the rest of time. So the pressure was sort of high. So I was pretty anxious while I was doing it. But the topic that I chose was, the title of the TED Talk is Living Well Even When You Don't Feel Well. And I used the first half, I'd say, of the TED Talk to kind of really illustrate what the difficulties and the problems with Lyme and the Lyme controversy are, to help people understand that better. In the second half, I really talk about the ACT approach and how the ACT approach can be useful in helping people to deal with Lyme and other chronic illnesses. In some respects, it's really like a nice, 17-minute synopsis of what the book is all about.
How instrumental is acceptance in making the recovery process with a chronic illness?
So I think it's critical, and the research really shows that people who reach a point of acceptance regarding their chronic illness tend to have a higher quality of life. We have to keep in mind that in ACT terms, that word acceptance, it does not mean giving up. People tend to associate that. Acceptance just means, there's nothing I can do. It's not saying you'll never get well. It's not saying you can't do anything to improve your life or your symptoms. It's just an acknowledgement that sometimes in a particular moment, you simply don't have the amount of control over your situation that you would like. And that might include what you're thinking. It might include what you're feeling, what you're able to do, whatever. And the idea is that struggling against it often ends up just causing you more problems and pulls you out of your life even more. And ACT, which obviously acceptance and commitment therapy acceptance is very high on the list of important things, basically points out that we're better off directing our energy at the things that matter and are more meaningful to us, rather than trying to control things that we can't control. I think it's really a key component to being able to live meaningfully if you have a chronic illness, but I recognize that word can be very loaded, and it's a little bit of a tough sell. So I write about that very carefully in the book to try to help people to get in the right mental space about it.
What are some of the steps that you suggest people use to overcome the misconception that acceptance is, quote, sucking it up?
So this is a hard one, especially because people in the Lyme community who have probably been to many, many doctors who haven't been able to figure out what's going on with them have been told over and over again to just accept it or deal with it or pull yourself up by your bootstraps or, some other such nonsense like that. As I mentioned before, this is not what ACT means by acceptance. It's just acknowledging that there are certain things that you don't have control over, whether it's your pain or what you're thinking or what you're feeling. And in moments like that, you essentially have two choices. You can try to pour your energy into controlling the uncontrollable, or you can direct that energy towards engaging in something, anything, no matter how small it might be, that is meaningful and important to you. The idea here is that you don't have to feel 100% well to be engaged in your life. You may not feel well enough to be 100% engaged, but every little bit helps, and that's better than throwing all of that energy down the rabbit hole of what we often refer to as the control agenda. I find that the only way to kind of get past this misconception about acceptance is to really to try it, to approach it from the ACT mindset, and it takes a lot of practice. But when it takes hold, I've found that it can be really transformative for people's lives, and that's really the whole point of what we're trying to do.
Do you have an example of one thing that people can practice in order to move towards acceptance?
So that's a hard question because acceptance is one of those 6 core processes that I referred to before, and it's really hard to think about them in any isolation. They're all intimately linked and related to one another, and they all kind of move into the sort of the circle of psychological flexibility. So when you talk about, what are ways that you can move towards acceptance? Well, there are 5 other processes that you can engage in to sort of help bring you there. If I had to sum it up into one word, I would say just be open. So we're always trying to, really sort of control what's happening and what's going on in our lives, and we get really caught up in trying to think certain things, feel certain things, or not think certain things, or not feel certain things, and that tends to just tie us up into knots. And the more open we are to our own experience and what we're feeling in the moment, the more likely you're going to be able to move to that point of acceptance. There's a lot more to it than that, but that's a really good first step.
One thing that stands out a lot to me in Living Beyond Lyme is how much it talks about mental health. Prior to writing your book or in preparation to write your book, what was the research and information like on mental health and Lyme disease?
Not great. We all know that funding for Lyme disease and tick-borne disease research is pretty limited as it is. Most of the funding that does go through ends up being focused on medical studies. That, of course, is very important, and I don't begrudge that at all. We need that work. But that work doesn't necessarily address adequately the behavioral and mental health aspects of Lyme and tick-borne diseases. There are lots of good people doing good work on this, but almost all the work that I've seen has been sort of self-funded. There's not a lot of funding, formal funding from the National Institutes of Health or any of those sorts of things, or really big dollar funding agencies to support the kind of research that we need, where you're doing proper controlled studies. We're getting there. The awareness is getting better, and there are really good clinicians and clinician/researchers who are doing work on this, but it's hard because the dollars aren't there. So there's a lot that needs to be done in this area.
Please redirect my phrasing, but something you emphasized in your book is that depression and anxiety and other mental illnesses can be a symptom of Lyme disease rather than a result of struggling with Lyme. How can someone with Lyme differentiate if their mental illness is a result or a symptom of Lyme?
So I'm just going to be honest. This is really hard. And first of all, the idea and the concept that the differentiation between the idea that I have Lyme disease, I have this chronic illness, and it's really hard on my life, and I'm depressed because my life isn't what I want it to be. That's obviously very real. Or I'm anxious because I'm not sure I'm going to be able to do something that I really want to do. That kind of depression and anxiety is certainly present in people who have Lyme and other tick-borne diseases, and people who have any chronic illness. But it's really important to recognize that the infection itself can and does enter the nervous system and can disrupt cellular functioning to the point where the infection itself is actually causing the depression or the anxiety. And figuring out what's Lyme-driven anxiety or what's Lyme-driven depression versus just sort of the quote-unquote normal depression or anxiety is really hard. It doesn't always behave the way we want it to, but there are a couple of things that an astute clinician can look for. First and foremost, doing really, really thorough individual and family histories is really important. So is there a history of any mental health issues in the family? That sort of feeds the narrative that maybe this isn't particularly Lyme-driven, but not necessarily. Inquiring about any possibility of tick bites, looking at the context in which the symptoms are occurring. So anxiety and depression usually, they usually make sense to a certain degree. But in Lyme, a lot of times they don't. So you'll see people with really sudden onset who have absolutely no history of any mental health issues, no history of any mental health issues in their family, living the life, can't necessarily identify anything that would lead them to having these kinds of issues, and boom, all of a sudden this stuff starts happening after they went on a hike or they were on vacation in a tick-endemic area or whatever. So those are things you can look at. You can look at the behavior of the symptoms. So, for example, anxiety in people with Lyme often behaves a little bit differently than it does in non-Lyme-driven anxiety. Lyme-driven anxiety tends to be more constant or long-lasting. It tends to be more intense, and it feels more prolonged. They come in these like sort of like huge waves where, like somebody has panic disorder, they'll be stricken with a panic attack that lasts maybe 10 or 15 minutes, and they'll have these really kind of short-lived spikes. But Lyme-driven anxiety tends to be much more prolonged than that. A lot of times you just kind of feel like there's something that's not quite right. The symptoms not behaving as though it would normally. It's not responsive to normal treatment modalities. If you can get started on a course of antibiotics and then the symptoms disappear, that's usually a good indicator that it was Lyme-driven as opposed to other factors. It's a very, very complex process. It's not always possible to differentiate whether it's Lyme-driven or not. Ideally, people are working with a really good team of medical and psychotherapy professionals that are coordinating care to help navigate this, but it's hard for sure.
In your book, you tell some stories of those who have used ACT and acceptance to help themselves in treatment. Could you tell one of those stories?
Sure. So I worked with a woman who she had dealt with chronic Lyme for a number of years, decades actually. It had forced her out of her job. She had to go into early retirement. Disability caused all kinds of disruption in her family, and as many people who have chronic Lyme can relate to, her life just got smaller and smaller and smaller to the point where she's essentially living by herself, not really going out, not really doing anything, and we used to talk about with her was very fear driven. She wasn't doing a lot of things in her life because she was afraid. She was afraid she wasn't going to be able to. Cognitively, she wasn't going to be able to function the way she wanted. So we worked through and tried to identify some things that she found to be really important and meaningful, and she's someone who liked to work with older people. So we came up with the idea of her maybe doing some volunteer work in nursing homes, and the idea of just going to a nursing home to interview for a volunteer position was absolutely terrifying to her. But we worked through this from an ACT perspective, which is there's this thing that's potentially really meaningful and valuable to you, and if you want to move towards that, that might not be comfortable, the fear part, but we have to accept the fact that that fear is going to be there in order to pursue what's meaningful and valuable, which she ultimately did, and she got the job doing the volunteer work, and she was great in that position, and it really kind of was transformative for her. She was worried about not being able to keep track of things cognitively. We came up with strategies to help her to do that, and she had a lot of really unrealistic expectations, which we tempered and managed, and she got to the point where she was really just able to engage and be much more engaged in meaningful and vital things in her life as opposed to just staying in her house alone by herself all day, which is what she was doing.
While Lyme is a focus of Living Beyond Lyme, what other chronic illnesses are discussed?
So there are lots of other illnesses mentioned in the book, but I don't necessarily discuss them in length, largely because I didn't feel like I had to. The book is really Lyme focused, but as most people know, Lyme is this so-called great imitator, and there's so much symptom overlap with Lyme and other chronic conditions. I really felt like the book as I wrote it, even though it's Lyme focused, was really applicable to a lot of different chronic illnesses. Also, ACT as a model is really designed ultimately to address human suffering. So acceptance and commitment therapy, it's not a Lyme-specific approach. It's a much broader, larger therapeutic approach that I'm applying to treating Lyme. But in the broader sense, ACT is designed to address human suffering. So the skills themselves are pretty broadly applicable, and I can't think, unfortunately, of many communities where, other than the Lyme community, that suffers more than they do. But ultimately, I think that anyone who's suffering from anything could relate to and benefit from what's in the book. And the ACT approach.
Would you recommend this book and the ACT approach for people who are not struggling with Lyme or a chronic illness, so that way the ACT approach is something that they're aware of?
Yeah, absolutely. I mean, the founders of ACT really, they don't really talk about it as much of a therapy approach. They think about it more as a way of life. And it's a way to exist in the world that is, they think, and I certainly agree with them, of course, that will help you to be less bogged down by expectations, attempts to control things that are uncontrollable, that help you to be more open, that help you to be more present and more engaged in your life. And those are the things that they would say lead to a more vital and more meaningful existence. And all of those things can happen even if you don't feel 100% well, even if you don't feel well at all. You can suffer and be in pain or not have things be the way that you want them to be and still be meaningfully engaged in your life in some capacity. And that's really what the ACT approach is about.
That's all the questions I have. Is there anything else that you would like to add?
No, I would encourage people to, whether it's in my book or, there are lots of other ACT resources out there. So Google it, look it up. You can go to the website contextualscience.org. There's a section there called ACT for the Public, so you can look at resources there. There are lots of other books out there. So while mine is Lyme specific, there are lots of resources for people to engage in, and I think that ACT can be a really meaningful and transformative approach to living people's lives, particularly for those dealing with chronic Lyme or tick-borne diseases. So I'm really appreciative of the opportunity to talk about it, and I'm really appreciative of the work that you guys are doing at Lyme Advise. I think it's a great service that you're providing.
Thank you so much, Dr. Trunzo, for taking the time to speak with me today about your book, Living Beyond Lyme and the ACT approach. Thank you.
Thanks, Anna. I appreciate it.